So it's what we recommend taking it with is Sweet Relief Cream. Sweet Relief Cream is our MSM. It's 12% lignosol MSM, so it's a trademarked MSM. We also have the capsicum and eucalyptus, so you get the hot and the cold. Now, when you use DMSO on its own, you may not feel the heat in the regional area for as long. When you combine that with the Sweet Relief Cream, I recommend to start off with the 2 parts of the Sweet Relief Cream to 1 part DMSO. And you mix it in your hands first and you apply it. You'll feel that heat after up to 12 hours later. So you'll put it on your lower back and you'll drive in your car and you'll think your heat warmer is on. It is not. It's just that it starts to heat that area, and it's very comforting. Then when you maybe have a shower that night or have a bath, you'll feel the warmth and the soothing of that combination. So it keeps the DMSO and allows it to work at a longer period of time. And it's very complementary because MSM is a component of DMSO.
Dr. Dahl, can I
Sure.
ask you some questions about the DMSO?
Sure.
So do our bodies create that naturally at all? Do we create our own DMSO?
No, we
Just found in the trees?
yeah.
Okay. And what it's doing, I want to understand the action by which it works in the body. So I can see there's a methyl group it provides so that we can accomplish methylation in the body.
Right.
And how is it transporting substances in? Do we know that? Is it because it's like MSM and it kind of, makes things more permeable, or?
Well, it increases the circulation, opens up the blood vessels, and it's easy to penetrate. That's what it does. It actually will penetrate into the soft tissues, will go right into the bloodstream. It's the mechanism of how it's constructed. It has the 2 sulfur groups. It's a sulfur group, and sulfur is very healing and blood purifier. It's a miracle product. That's all I can say. It's a miracle product.
So the sulfur groups are having a lot of impact there too.
Yeah.
And when you're using it with a cream like the Sweet Relief Cream, which do you apply first? And
I would mix them together first in your hand.
Put the one all.
Yeah, all together.
Okay.
Yeah, go ahead. And so there's been additional studies, of course. I think you all aware of the studies on MSM. So they've done double-blind, placebo-controlled studies, examined the effect of MSM, 50 men and women who all had osteoarthritis and pain in their knees. MSM improved both pain and physical function without adverse side effects. In other studies, they were taking MSM, and over 80% of them had better control over their pain than on placebos. So the studies are, I think DMSO is probably next to Sammy, and GH3 is probably one of the most researched products in the world. The clinical studies on it are incredible. It's been if you look at our website under media, there's a 60-minute report that they did, a full hour on DMSO, and it's incredible to watch how Dr. Walker is putting this on this patient, how she recovered and nothing else would work. It goes into that how the person was playing a piano. She couldn't play. She had the skill to play, but her arthritis was so bad. And you put the DMSO on, and at the end she could play the piano without pain. So this is how incredible. Actually, George Wallace, the presidential candidate, went to him and had it applied. Senator Kennedy went to the House of Congress down there and lobbied. It was when that DMSO program was on 60 Minutes, 70 million people viewed it. And they inundated the government to have it approved, but they would not approve it. This product would replace all those prescription drugs, and they would not allow it to happen. So there was big money, and Crown Zellerbach was one of the sponsors for it. So they had the money. It's just that they did not want to allow this product on the market. So Sweet Relief Benefits. So this is where I say to take a half a teaspoon 2 or 3 times a day when combined with DMSO. DMSO, 2 parts sweet relief cream, 1 part DMSO, and once you become used to this, then I would add it to raise it up to a 1-to-1 level. And then if, depending on how it is, 2-to-1 level. Very good for anyone that's in sports, any dancers. My wife is one, so she's it won't go anywhere without it. And all the dance troops, everyone takes the DMSO and sweet relief because of the relief they get. It's just amazing. And so it's temporarily relieves aches and pains in muscles, joints associated with arthritis, simple backache, lumbago, sprains. So the capsicum eucalyptus help with the warming and cooling, as I said, and it's helpful for inflammatory conditions. Sweet relief cream at 2-to-1 ratio lengthens the localized effect of the DMSO. So it's a 12% Emisol Lignosol trademark brand. Go ahead. The next product is DL phenylalanine, DLPA. Are we familiar with DLPA at all?
All I know is in babies, right? If they are lacking, they do that phenylketonuria test, right? And if they're lacking the ability to metabolize this enzyme, this amino acid, then they cannot eat any foods that have it.
Yeah, that's right.
Yeah, okay.
So they have to avoid this product. But most people don't have that problem.
That's true. Most people don't. You know, if you have that problem, you know, right?
Oh yeah, you definitely know. So we have that on our label that it's the warning, so it's there. So DMSO is an essential amino acid. So we need to take it into our bodies, either by our food or by supplement form. The form we have is by a fermentation process. It's so it helps to control pain and balance moods. Now, it relieves pain from whiplash, rheumatoid arthritis, lower back pain, migraines, muscles, cramps, soreness, post-operative. Boosts emotional euphemism, so it makes you feel better. Helps by fighting depression. Its effectiveness actually increases over time. And so it's very good for post-exercise soreness and appetite, and improves workout focus. Now, I've taken this personally. I've taken it prior to getting orthoscopic surgery. So when you can anticipate something is coming that's going to be painful, then DLPA is a perfect product to take. Now, if you're like me, a weekend builder, maybe you should always take it because it might whack your thumb with a hammer. But this is what DLPA. When I took that, I took six capsules, 10 days prior to going to surgery. And when I went in, of course, they put you under. And when I came out, I was placed in a recovery room with all other patients that had similar surgery. And they were all on morphine, throwing up. And the nurse said, "Would you like to have an injection for your pain?" I said, "I have no pain." And I said, "I could even eat this hospital food." So then I might have pain. So then everyone else was sick, and she said, "Well, don't be a hero." I said, "I'm not a hero, I just don't have pain." And I told her what I would take, and then she started writing it down because she thought that was kind of cool. So for personal information, how effective it really is. So take it within the body days before, and it will start building up and stay stored in the tissues, and then you can lessen the amount as time goes on. So the benefits: 6 per day for the first 10 days, and then follow up with 4 per day or 6 per day, depending on your level of pain. Very good for arthritis. So helps with mood, pain, memory, learning, and appetite. So it builds the body so that it no longer needs to be taken so much. It's non-addictive. It's an amino acid. So it may help relieve from whiplash, rheumatoid arthritis, lower back pain, migraines, muscle cramps, soreness, as well as post-operative pain. So DLP alleviates the emotional and physical symptoms prior to the onset of having menstruation. Also shown to be to curb cravings and carbohydrates, tobacco, cocaine, and other addictive products. So like tyrosine, the other amino acid does. it has that same benefit. So it'll work if you take it. You'll actually have, it works like an appetite suppressant. So it has a side effect that you may lose a little weight, so that's not too bad. The next product is Sammy. Sammy is an amazing product. I could spend the whole hour on any one of these products and go into the training and go into all the clinical data and the scientific studies. But our time doesn't allow that. Sammy helps to promote mood and balance. If you know anyone that's in depression, Sammy, almost within a day or two, they'll notice the change. I've had someone that was working for us, and I know he wouldn't mind me saying this, but his mother is raised with his mother, and he told us himself, and Rhonda was there, that he says, "You don't know my mother." He says, "But I've never seen her happy." And I asked her, I'd say, "How are you, Mom?" And I would get all the reasons why she's not happy. So I said, "Sammy, give her Sammy." So she took Sammy, very, very hard to convince to try, but she took the Sammy. She took 80 drops, 40 drops twice a day. And he phoned her 2 days later and says, "Hi, Mom, how are you?" "I'm good." And she was shocked. He said, "What's that again?" He says, "I'm good." He says, "How is your condition?" I feel normal." He says, "The first time I ever had my mother say she was normal, felt normal. And that was after only 2 days." So it had such an impact on him, and I'm relaying his story from his mother. So this is fresh information. You never have, like we sell a lot of Sammy, but we don't get the feedback like that. So it's nice to hear how powerful and effective it really is. So it supports the liver also, and relieves pain and cleanses the liver. Also, what this product is amazing for, say if you had to get a liver transplant and you're on a waiting list, what they do is to give Sammy, so it preserves the liver long enough so they can wait for the liver transplant. So this is an amazing product. Actually can regenerate cirrhosis of the liver. Yeah, it's an amazing product. Go ahead. So this is another methylation map to show how methylations work. So we have Sammy, we have methionine. These are all part of the homeocysteine. And then we have the tryptophan, the tyrosine, the arginine, the ornithine, the urea cycle that it goes through. And so we see that methylation group is extremely, extremely important in the body. And the wonderful thing is about these products is they're all part of the methylation group. The DMSO, the sweet relief cream, the DLPA, and the Sammy. So this is how you get the healing that happens within the body. And it starts to work on so many different levels when you have these balances within your body. Go ahead. So in 1999, Time, Newsweek, and USA Today magazine said Sammy is comparable to state-of-the-art treatment for both depression and arthritis. It promotes joint health by contributing to building blocks of cartilage and prevents migraine headaches. We are the only company that I know of that has a stabilized liquid version of Sammy. And the reason why we developed this, it took us several years to have it stabilized, is because the other version is enteric-coated tablets. And there's so many binders and excipients that it relies on the large intestine to break it down to get into your body. And if you have a digestive issue, then you will not be absorbing as much. So this goes directly into the bloodstream, and it's quickly absorbed. Sammy Benefits is mood balance, said to be as effective, if not more, than prescription depression medication. So pain relief, especially osteoarthritis, fibromyalgia. Liver benefits, preserves the liver for those who are on transplant waiting lists. Go ahead.
I do have one question. Okay, will the SAMe still work when somebody is constantly consuming alcohol?
Well,
That's what I'm asking.
Yeah.
You know, but is it
Yeah.
what I'm suggesting to someone who is,
it's not going to interact. It will help.
it will work still?
It will help.
Okay.
I mean, but it's like having a fire and throwing more gasoline on. So but it does help. It does help. But what we should be doing is trying to help them with the alcohol by high doses of tyrosine. That'll help to lower the addiction level. So it's good to know, because some people won't change, and so you have to treat them as you have them.
That's why I was asking that question.
Yeah, and one other thing I'm not talking about it today, but since we're talking about this, is we have our CAVA is our clinical studies that they did for treating people with that are smokers. They don't want to stop smoking, and they found that taking CAVA that it protects them from developing lung cancer. So if you know of a smoker and he's not going to stop, then get him on our CAVA. Our CAVA is the 5-year noble root from Fiji. It's grown. It's the purest in the world, and if they're not going to stop smoking, at least you're going to preserve their lungs.